In 2010, nursing faculty in academic nursing programs in Wyoming joined together with nurses in clinical settings from across the state to work on transforming Wyoming's nursing education and finding new ways to keep pace with the rapidly changing world of healthcare. This group of nurses became known as ReNU, the Revolutionizing Nursing Education in Wyoming Consortium. Working together for 6 years, this group adopted concept-based learning as a new approach to nursing education. Nursing programs belonging to the ReNU Consortium implemented concept-based learning both in classroom and clinical courses in fall 2016. This video will give clinical faculty and instructors, and anyone who works with nursing students and is interested in concept-based learning, an example of how this learning paradigm can be used when teaching in any kind of clinical setting. Concept-based learning can be used when teaching nursing students during clinical in acute care settings, long-term care settings, community settings such as schools, public health, home health, or anywhere nurses interact with people. Concept-based learning is designed to present carefully selected key concepts that nurses need to know. Teach these concepts one at a time in the classroom. Carry that one concept over into a lab setting, and then apply the same concept in any clinical setting. This learning sequence should occur in as short a time frame as possible. Intentionally structuring student learning in this way helps students to learn and transfer key foundational concepts across all patient care settings and situations when they become nurses. Concept-based learning intentionally moves students away from learning through memorization in favor of learning through pattern recognition, which is facilitated by faculty who guide students in reflecting, interpreting, responding to, and evaluating patients and their unique circumstances and conditions. Here is an example of how the concept of perfusion can be taught using the concept-based learning approach. Students work together in the classroom on a case study focused on the concept of perfusion. 2 days later, these same students spend time in the simulation lab, applying what they learned in the classroom case study. A few days after that, a clinical instructor takes these students to the hospital and helps them apply what they had learned about the concept of perfusion from the case study and from the simulation lab exercise to patients in need of nursing care. In this case, the clinical instructor met the students in the education department, where she guided them in applying the concept of perfusion using CPR mannequins. For this particular concept-based clinical, the clinical instructor came to the hospital on the day of clinical to look for patients experiencing cardiac dysrhythmias and associated healthcare conditions. Then the instructor took the students to the acute care setting, where they reviewed charts of patients the clinical instructor had selected. The students reviewed the patient's rhythm strips, guided by questions about the concept of perfusion from the clinical instructor. After reviewing rhythm strips, the clinical instructor and students visited with the selected patients. The students spent clinical time conducting physical assessments and interviewing the patients. The students did not perform total patient care or dispense medication, but the clinical instructor did facilitate discussion on the patient's meds and the patient responses to those meds. The instructor and students also spent time reflecting about assumptions the students had made about the selected patients based solely on documentation found in their charts. The entire concept-based clinical experience lasted 4 hours and covered every clinical objective using creative alternatives to traditional total patient care. Clinical time was used in a purposeful, deliberate, yet creative manner. This example provides some idea of what concept-based learning in the clinical setting can offer to students and to clinical instructors. Concept-based clinical experiences do not replace traditional patient care, as there is still significant value in the traditional clinical model. However, concept-based clinical, particularly early in students' academic clinical rotations, can provide them with opportunities to make meaningful connections between concepts in an environment where they are not pressured to perform many tasks and try to apply concepts at the same time. Concept-based learning in clinical reinforces key patient care concepts through pattern recognition, which can then be transferred across all patient care settings and patient situations. Another advantage of concept-based clinical is that it does not require the 8, 10, or 12-hour shifts that can be exhausting to students and clinical instructors. We leave you with these thoughts.
So how your program integrated the classroom, the lab, and clinical was perfect. And in the accelerated program I'm in, we were able to use concept-based clinical throughout longer shifts, and the students did mention that that was very helpful, having learned a concept in the classroom, which theirs is an online classroom, and then coming to clinical where we focused on the same concept over and over and over again throughout a longer shift. So what would be your words of wisdom to faculty and programs just starting concept-based clinical or thinking about adopting concept-based clinical?
My advice would be to keep it small. You want to stay with just a concept that's easy to do. Infection's a real easy one, nutrition, oxygenation, things that they can assess for, and you have them assess, apply what they're learning in the classroom, and they use their interventions. You have to stay away from diagnoses because that's going to steer them off. It's the concepts that go together is your best bet. If you need to scaffold it, then go to the harder concepts later on, like perfusion is a really good third semester type program. No big assignments, no study guides. You want them to be able to get there, apply it, and then be done, not be worried about filling out an assignment the whole time that they're not focused on what they're doing.
I would say that you have to let go of the traditional clinical. I think there's value still in the med-surg clinical, but it takes away the stress of taking 1 to 2 patients and being responsible for 16 patients and only task-oriented. With concept clinical, you can be creative. You can have different settings. You can utilize different disciplines versus just an RN as a preceptor, or that introduces the interdisciplinary, and then it takes the stress out of total care of the patients and the responsibility that a clinical faculty would have. I remember when we first started this, Marlene Ethier began this with us several years ago, and she had told me that she didn't say it would be easy, she said that it would be worth it.